Good afternoon, ladies and gentlemen. My name is Cheryl Davis, and I have been given this opportunity to present a PowerPoint today concerning moral rights to health care. In my presentation, I will cover code of ethics, resource allocations, and cultural competency. I'm focusing on the awareness about the moral rights to health care for all Americans. In our contemporary society, individuals who can get access to quality health care are those that are well off financially. For the rest of the people who cannot afford to cater for their health care as well as ensuring their health ends up with insufficient health care. Quality health care should be available to all individuals. However, every individual is entitled to receive health care regardless of their financial situation and their abilities to afford the care or not. Hence, the reason for universal health care programs such as Medicaid. Vital elements of moral rights to health care. The vital elements of the moral right to health care entails these three factors. The Code of Ethics ensures that everything is performed in accordance to what is universally acceptable. Proper resource allocations ensures the quality of life is provided and the quality of care serves as the yardstick to evaluate performance and customer satisfaction. We shall expand on these three elements. Code of Ethics. Maintenance of moral rights through paying respect and dignity to human life. Attend to patients with proficiency and kindness without biasness. Protect confidentiality and privacy of patients being attended to by the physicians and healthcare organizations. Public education on threats and personal healthcare maintenance. The Code of Ethics is about ensuring that moral rights to the healthcare field is maintained and respect to the human life is ensured. Life is scarce and must therefore be cherished and protected at all costs. Moreover, considering the dignity of every individual must be of a concern to the medical personnel, and having respect to life, crime against the humankind must never be condoned. It is the requirement of medical personnel to utilize their skills in saving lives despite risks involved. Colander and Copper, 2018. Showing compassion to the injured and sick while treating them brings out the human nature in people and therefore recommended. The core of all the medicine is that every human life is priceless. By this, all healthcare practitioners are expected to value all lives and work without bias. Confidentiality and privacy are a core principle in healthcare and must be upheld at all times, no matter the cost. This cannot be compromised. Educating the public on the threats of life for cautious as well as mentoring and tutoring the young generation for better medical care is assuring to a better future. Finally, working freely with colleagues in the attempt to have an advancement medical field is a step to having more rights to health care. Resource allocation. That means a steady flow of money to healthcare organizations, transparency of allocations of resources from the government to healthcare organizations, advocates for smooth running of healthcare organizations. There should be a hierarchy in the allocation of resources to ensure that the medical field does not lack the finances that aid in the running of the facilities. Consequently, access needs to be in an organized manner that clearly oversees how the resources are injected in facilities and the results. With proper allocations through the injections of factors and resources into the hierarchy, then there would be without a doubt a visible increment on the output. The flow of money to the hospital would be on the steadfast and stabilized, wherein no facility would lack. The medical personnel will receive their pays in time and therefore having a delivery of the best service to the public. Integrity is also key for impactful use of resource. Transparency will enable proper accountability and ultimately lead to improved output. Setting up overwatch organizations to ensure accountability is one probable approach to ensure transparency. This can be effected at the basic organization level by encouraging durational audits and constant follow-ups. With sufficient resource allocation, there is without a doubt no possible reason smooth running that engenders quality care delivers is unattainable. Quality of care. Healthcare providers should deliver desired healthcare outcomes. Healthcare organizations should advocate for patient-centered care. Improved quality results and patient satisfaction should be top priority. And having the best medical service offered to the patients, then the likelihood of having more individuals seeking medical care would increase. The patient seeks to experience the best of service from the medical team, wherein they are able to recommend others to visit the health services. Fletcher's 215. This said, healthcare providers should be encouraged to provide desired healthcare outcome. If more people seek services, then this is bound to lead to increased profitability. This in tune in each organization's desired outcome. The best servicing range from taking into consideration the patient's need first before their own interests. Besides offering the best service, the patient requires the media team to have a good relationship with their customers. Having personnel who cannot interact with the patients would see to the patient seeking alternative ways of medical attention. Therefore, the facility and the service should be patient-oriented and centered. Quality is a key performance indicator in any organization across all fields and industries. Therefore, it goes without saying that customer satisfaction from improved quality should always be sought. And that ends my presentation. I want to thank you guys for your undivided attention, and hopefully we can come to an agreement in moral health care. Thank you so much. Have a great day.